treatment of varicose veins and venous insufficiency was traditionally accomplished with an operation called ligation and stripping. At that time, the patient would receive multiple incisions which would remove the main vein that was causing the problem. That vein is generally the great or long saphenous vein. Currently, and for the past several years, we've been performing minimally invasive, image-guided, targeted treatments to address the main vein that is the problem. After reviewing the venous duplex ultrasound mapping examination, we can pinpoint the vein that is abnormal and offer the treatment, again, through minimally invasive treatment options to address the problem. The main treatment that we perform is called endovenous ablation. That procedure is accomplished where we take a small catheter or thin tube that has a heating element on the end of it with either a radiofrequency heat or laser, and we can put that catheter using ultrasound guidance directly into that great or long saphenous vein and thread it up to the top where the problem is existing and then close the vein with that heat. What happens when we close that vein, blood will no longer go down in the wrong direction from the abnormal valves that I previously described. Endovenous ablation is a very effective procedure, and the beauty of this procedure is it's very safe, it's an outpatient procedure, it's effective, and it has a very low recurrence rate after treatment. It's an outpatient procedure that patients come in and go home the same day. Other procedures to treat venous insufficiency depend on the size of the veins and the abnormality that we identify. Sometimes we perform a procedure called micro or mini phlebectomy, where we're actually removing some of the branch veins that are down in the legs that can't be treated with the endovenous ablation catheter. In addition, we perform procedures called compression sclerotherapy, where we're injecting a liquid agent into the smaller veins, which helps close those veins and eliminates the venous insufficiency. As opposed to the ligation and stripping surgery that was done in the past, the recovery from endovenous ablation, compression sclerotherapy, and microphlebectomy is very quick. Patients go home the same day of the procedure, they're wearing a compression stocking for a couple of weeks, and generally they are back to their normal activities within a couple of days.